Tonight, as more hospitals report spiking cases of COVID-19, confusion is mounting over what should actually count as a COVID hospitalization. Right now, anyone at the hospital who ends up testing positive for COVID there is counted by the CDC. In cities like New York, recent numbers show just over half of those counted as hospitalized with COVID were there for something else.
They might be having a stroke, they might be having a heart attack, and they just end up being positive just because of the community spread right now.
At Los Angeles County hospitals, 2/3 of COVID patients were admitted for other causes. Same in the Bay Area.
So it's possible for somebody to come in with a broken arm or a broken hand and become a COVID positive case.
Exactly. As of Tuesday, we had 40 adults hospitalized under the designation of COVID positive, but only 12 were hospitalized for COVID illness.
ER Dr. Jean Noble says before the vaccines, most of those testing positive in the hospitals were in need of critical COVID care.
My job went from patients coming in respiratory distress, worrying would we have enough ventilators, to now in January of 2022, the majority of people who come in with COVID, I discharge home really quickly.
She says today most severe cases are among the unvaccinated, while the high hospitalization counts among children in the Bay Area appear to paint a much more dire picture than what they're seeing in the emergency rooms.
We had 19 kids hospitalized for COVID, but only 6 were in-house, were admitted patients because of COVID.
In Marin County, California, out of the 20 listed as COVID hospitalizations last week, 10 were admitted for COVID.
So out of those 20 cases that were being reported to the CDC as COVID-19 hospitalizations, 3 of them were women that were asymptomatic that were delivering babies?
That's right. That's right. And if we don't understand the distinction between the people who might be in the ICU on a ventilator who are truly there because they're infected with COVID-19, we might overestimate the burden of Omicron.
Now doctors calling on the CDC to specify how patients who test positive should actually be counted.
We have simply been reporting patients who test positive for COVID in one big bucket, and those numbers go to the CDC. And that's what we've really got to change.
Gadi, it's fascinating, but given everything you just said, there are still hospitals that are very much overwhelmed, right?
Absolutely. And the experts we talked to say that there is a significant crisis still happening within hospitals, but so much of that crisis has more to do with the staffing shortage and staff and healthcare workers testing positive for Omicron than it does with the severity of the disease.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.